Any difficulty in study? Relax. Dental Anupam is here. Today we discussed about the most important development is the development of mandible. Basically, development of mandible is a process, but for better understanding, dental Anupam is divided into eight step for better understanding. You cannot mention it in examination hall or examine paper. So now go to the each steps. I repeat once again, it is each step only for a better understanding. It's not mentioned in exam paper. You can write process step by step by use of para change. Now go to the first. Ossification of mandible start. In 6 weeks of intrauterine life, Meckel's cartilage extends as a solid rod of hyaline cartilage from the otic capsule to the midline. What is the Meckel's cartilage? Meckel's cartilage is a cartilage of derivative of the first branchial arch, and help of this cartilage development of mandible is occurs. The right and left side cartilage are separated in the midline by a thin band of mesenchyme, and the cartilage is surrounded by a fibrous capsule. The inferior alveolar and the lingual branch of mandibular nerve runs along the medial and lateral aspect of cartilage. The inferior alveolar nerve bifurcates from the incisive and mental branch at the site of the future mental foramen. Later, a mesenchymal condensation appears on the site near the bifurcation of inferior alveolar nerve at the site of future mental foramen. In seventh week of intrauterine life, a single ossification center for each half of the mandible begins in the mesenchymal condensation. So the first ossification starts at the region of future mental foramen. The mandible is the second bone after the clavicle to ossify in the entire skeletal system. Now go the start of formation of body of the mandible. The ossification spread around the inferior alveolar nerve towards the point of the future mandibular foramen posteriorly and towards the midline anteriorly. The ossification forms a through around the inferior alveolar nerve and is later converted into the mandibular canal, in which the nerve lies. For this bony canal, alveolar plates developed in relation to the developing tooth jam. After the formation of the body of the mandible, ramus formation start. Now go to the ramus formation. The ramus is formed by the spread ossification posteriorly to the mesenchyme of the first arch. Mandibular foramen is almost complete by the end of 10th week, and we are called this rudimentary mandible. Uh, it formed almost entirely by intermembranous ossification and entirely independent of Meckel's cartilage. The union of two separate center of ossification center in the midline between the 4th and the 12th month postnatally. Ligament formation. The dorsal end of Meckel's cartilage ends in tympanic cavity of the middle ear and is surrounded by developing pectoral part of the temporal bone. The auditory ossicles, incus and malleus of the inner ear are derived from Meckel's cartilage. A part of the cartilage transformed to from the anterior malleolar ligament. During 24th week of intrauterine life, the major portion of Meckel's cartilage between the mental foramen and mandibular foramen degenerate, while the fibrocellular capsule of the cartilage persists between the lingula of the mandible and spine of sphenoid as sphenomandibular ligament. Some remains following accessory endocaudal ossicle are evident in symphysial region, ventral to the mental foramen. Now go to the secondary cartilage formation. Why secondary cartilage formation? Body and the ramus formation is complete, but condyle, coronoid and symphysis are subject to ossification. That's why secondary cartilage formation start. Secondary cartilage formation. The growth of the mandible further take place by the appearance of three secondary cartilage: condylar cartilage, coronoid cartilage and symphysial cartilage. Those cartilage are developmentally and functionally different from Meckel's cartilage, which is a primary cartilage. Meckel's cartilage is primary cartilage and condylar, coronoid and symphysial cartilage is secondary cartilage. Now go to the condyle formation. The condyle appears as a cone-shaped cartilage during the 10th week of intrauterine life, occupying most of the developing ramus. The condylar head increase in size by both interstitial and apostitial growth. The first evidence of endocaudal ossification is seen in the 14th week of intrauterine life. By the 20th week, the most of cartilage is replaced by the bone, and only a thin layer of cartilage remains in the head of the condyle. The remnant of the cartilage is present in the adult life as a growth cartilage and articular cartilage of the temporomandibular joint. Now go to the coronoid formation. The coronoid cartilage appears in the 14th week of intrauterine life, contributing to the development of the coronoid process. It soon become incorporated into the developing ramus and disappear before the birth. Now go to the symphysis menti formation. Two islands of symphysial cartilage appearance on the either side of the midline in the symphysial region, independent of Meckel's cartilage. Each ossify in the 7th month of intrauterine life, but as a variant. Some remnants may be present as mental ossicle in the fibrous union of the mandibular midline at the birth. Those ossify and the incorporated into the bone postnatally, during which the fibrous union cause syndesmosis between the two halves of the mandible, converted into a bony union, synostosis, and development of the mandible is now complete. Thank you, and you can join my Telegram channel for notes, PDFs, etc. Link of the Telegram channel is in description.